Is that my window?
Yes.
Thank got it.
Okay.
That is my window.
Now we're at the next. Okay, so there's different product types. I know a lot of people get overwhelmed when they're at the store. A lot of people spend money on products that are the wrong products, and then they get frustrated at that point and kind of give up by the time they come to someone who's an esthetician. So there's different type of cleansers. There's oil cleansers, gel cleansers, cream cleansers, and more. The one that's best, it depends on your skin. So oil cleansers are really good for someone with oilier skin because the water and oil just don't mix. That's why you need either like a foaming cleanser or an oil cleanser. Oil cleansers are also great if you're wearing makeup. So that could be a first cleanse after a night out because that's going to help remove the makeup a lot better, but you should always cleanse twice after wearing makeup. There's different types of exfoliators. There's chemical exfoliators, enzymatic. Enzymatic would be something like something that has pumpkin in there or papaya in there. So that helps to dissolve dead skin cells on the surface. There's also physical scrubs, which it's not for everyone. For some people, that can be a little too aggressive on the skin. And over scrubbing does the opposite effect. It's horrible for the skin. It's going to break down the barrier. It's going to break down collagen in your skin. Toners and astringents. Toners tend to be more soothing, more hydrating. Rose water is one of the best you can use. Honestly, I get a rose water toner from Whole Foods and I love it. Astringents, that would be more like your witch hazel, which is good for those with oilier skin or post-electrolysis treatments. Moisturizers, there's lotion-based, cream-based, which is just heavier, gel-based, water-based, and oil-based. Typically, somebody with oilier skin tends to gear towards the gel or the water-based. Somebody with drier skin goes towards like the lotion in the day, cream at night. Cream tends to be a bit more like repairing and heavier on the skin. So that's why overnight it's pretty optimal. SPF, there's physical, chemical, and hybrid. Physical would be like your zinc or titanium dioxide. I prefer a zinc base because zinc is the only one that's fully broad spectrum, protects you from UVA and UVB rays. Some people are put off by the zinc because it leaves like a white casting. You could always try to find a tinted SPF. There's a lot of different brands nowadays that have that. Like one of my favorites it's called Kula, and you can get it online. You can get it in Ulta, Sephora. What's the one that you really like? The sunscreen that you like?
Alta MD.
She uses the Alta MD one, which she's in love with. I tend to not get, I don't like the word chemical because all the products are chemicals. However, with chemical sunscreens, a lot of these are banned in different places now because they're affecting the coral reefs. Yes. So like I believe avobenzone, oxybenzone, those are ones that if it's a primary ingredient in the SPF, they're banned in Hawaii and other places. Yes. Then there is a hybrid. Hybrid will have chemical and physical combined. Those are usually some of the best ones, to be honest. Those hybrids also will have anti-aging ingredients in there. Caffeine is a really good ingredient in sunscreen because it's going to help with anti-aging. It has antioxidants in there because when you're outdoors, you're also getting some pollutants, free radical damage, and the caffeine helps to neutralize those free radicals.
So would the hybrid ones also be banned in places where the chemical ones are?
Typically not. It's more that typically not because those hybrid ones are usually primarily active ingredient is zinc. And then so it depends on how active the ingredients are. Typically, when you're looking at like a product list and the ingredients, the first ingredient is going to be the strongest, then it goes down from there. So that's how you read it. So you'll also learn that there's a lot of expensive brands that starts off with products that you're paying a lot for and it's not worth it. So that's one way to read your product labels. I always read product labels. So a basic skincare regimen, this is the bare minimum someone can do, is you would cleanse morning and night. There's some people who do not like to cleanse both morning and night. So I tell them cleanse in the evening at least. That's the most important time to cleanse. Okay, because over the day, if you're outdoors, you're exposed to pollutants. Our skin creates natural oils, which also help to harbor bacteria. And we accumulate dead skin cells throughout the day, like thousands and thousands and thousands. So it's important to cleanse in the evening, especially. Exfoliation. So there's different types of exfoliation, and we'll kind of go into that a little bit. But you want to exfoliate every other night. Exfoliating every night for some skin can be pretty aggressive. And like I said, like break down actual collagen in the skin. So whenever you're using exfoliation, you don't want to use a lot of pressure. So it should always be like feather-like touch.
As you're talking about this, is there a distinction based on age? You might notice we're a slightly older group here.
So not necessarily age, more based on skin type. So someone that's oilier may need a combination of different exfoliants. So they may need a physical exfoliation and they may need to use a retinol. Typically you want it, like glycolic acid tends to be a good one, but it's not as good for darker skin tones because it's actually has the smallest molecule. So it penetrates fast and it's kind of unpredictable with darker skin tones.
We don't have a lot of those here.
Yeah, so typically that's a really good anti-aging product to use something with glycolic in there. And then you're gonna also, we'll talk about retinol in the next slide because this is the basic one. So basic exfoliation would be like a facial scrub or a glycolic acid that you use.
So I don't use an exfoliant right now. So what would be a good one?
We're gonna go over different types.
Oh, that's coming up later. Okay, got it. Okay.
So when you exfoliate, you're actually removing outer layer of dead skin. So you'll notice right after you exfoliate, your skin's gonna feel more polished, a lot smoother as far as texture. It also helps with excessive product buildup. That sunscreen tends to sit and it tends to get clogged in pores. Makeup tends to do that. So exfoliating is going to help break that stuff up. So your skin's a lot cleaner. Yes. Not everybody does that, surprisingly. Or not everyone cleans their makeup. Not everyone cleans their makeup brushes as much as they should be. They should be. Well, technically, you should be cleaning it every time after every time you use it. No one does that. No. Weekly would be great. I could go over how to clean makeup brushes if you like. You could just use a little bit of like baby shampoo. What I've always done is I'll put a little baby shampoo on the back of my hand, dampen my brush, and then kind of rub it in circles, and you'll see just dirt coming down, coming down, coming down. Wow. And you do that until the water turns clear, and then you set it on a paper towel to dry. So that's how you clean your brushes. They also have brush cleaner products. Baby shampoo does the job. I don't want to pay $20 for a makeup cleanser for my brushes. But they do have one. Japanesque has one, but it's probably like $20 for the cleanser.
The baby shampoo is a lot.
Yes.
But you just put a small amount on your hand.
Yeah, you just put
it on the brush.
No, I put it on my hand and then I kind of go in circles and clean it, and then you just see tons and tons come out under the water. Okay. So you do that until the water runs clear. Okay. And you always air dry. You don't want to use anything you don't want to use a hair dryer, anything like that. That's going to damage your brush. Oh. And some brushes get pretty expensive nowadays.
So be patient.
Yes, be patient. So at least if you wear makeup every day, you should clean it at least weekly. So moisturize twice a day. Typically, you can use a lighter one in the day, heavier at night. If you'd like, you could use the same one day and night. It's up to you. So that helps the skin become more hydrated, plump, and it gives you a nice glow. If you don't like heavy textures or creams, you can try gel or a water-based one. Yes, oily skin should be moisturized. Actually, if you start moisturizing when you have oily skin, within 4 to 6 weeks, it's going to help balance that excessive oil production. Physical SPF, we kind of spoke about that. I always prefer zinc.
Mhm.
All right, we're gonna go on to a little more complex one next, which is mine. So the advanced skincare regimen would be you're cleansing twice a day, you're exfoliating, but you add on a second exfoliant, which would be like a lip scrub. Like this is a big one. A lot of people don't do. It makes a drastic difference. I'm a huge lipstick person. If I don't have very much makeup on, I at least have eyeliner and lipstick.
Mhm.
So they have lip scrubs. They're not very expensive. You can get them for like $5, $8. And while you exfoliate with the other stuff, you could kind of go in circular motions on your lips. That helps to get off the dead skin cells, any makeup buildup also. Especially with the like the very drying lipsticks that stay on for a long time, that tends to get caked on in your lips. Next, you would do your toner that tends to help to restore the pH back to normal and immediately hydrate. Now, while the toner is still damp, that's when you start applying your serums. Serums is going to be different for every single person because it depends on what your concerns are. Some people may want to work on target areas like the 11s, when people get lines right here, right around the eyes, crow's feet, nasolabial fold lines, which realistically, product's not going to do a lot for the nasolabial fold lines. That's more of something that's going to need the injectables. I believe they put filler there nowadays.
Mhm.
Yeah. So again, it varies for everyone. It depends on what your concerns are. I suggest everyone use a retinol. Everyone should be using a retinol. If you've had a bad experience with a prescription strength, you need to try it over the counter of 5%, 0.5%. A lot of times prescription strength is a 1%, and you get that dose. I believe it's like in 2 hours, you get that whole dose. So some people get effects that scare them and they don't go back. Retinols,
That's a serum.
it will be a serum or like a cream.
Okay.
Retinols tend to smell pretty funny. It's not expired. It just has a unique smell, and some may be like an orangish tint. That's why you only use it at night. And you kind of work your way up with it. Some people will start off a couple of times a week. Your skin has to get used to the retinol, so you're working your way up.
I use Educator with retinol. I have age spots. Does that work to help fade them?
It does, but to fade them faster, you would need a stronger retinol.
Oh.
Mm-hmm. So what happens is, as we get older, the cell turnover slows down and our skin becomes a little more sluggish. We get a little gray tone, all that good stuff. Retinol helps to regulate the cell turnover. It's amazing. It's a derivative of vitamin A. Everyone really over 20 should be using a retinol. And there's different kinds of retinol. There's anti-aging retinols. There's retinols that help with discoloration that also have natural brighteners in there. So there's a lot of different options with that. Another step would be adding an eye zone product, and it has to be specific for the eye zone because it's very delicate skin there. Our eyes are one of the first places that show signs of aging more than everywhere else. That's because skin is thinner around the eyes, and we have less oil glands around the eyes. So that's why it starts to show more. So you want to make sure you're using an eye zone product twice a day to really see results. Once a day, it's going to help, but twice a day is going to keep it nice and tight.
So what, an eye zone product, that's something like
You were using the PCA for a while. That's your eye zone. That was your eye zone product.
Okay.
Ideal Complex.
Okay.
Yeah.
Yeah, that one. All right. So I think I've been, well, I actually haven't since my surgery. I haven't used anything for what I'm supposed to, but I was using Estee Lauder to what they call it, rejuvenation or something.
Yeah, as long as you weren't having any type of irritation to it, that's fine. Usually you want to look for like a hypoallergenic eye product. Just because, like I said, that product does tend to react faster to things it doesn't like. So if you start using something and you get puffy, that means you're having a sensitivity, not necessarily allergic. You're having a sensitivity to something in there. Ulta is known for their generous return policy. So if you're looking for something over the counter, you can, if you decide to get something from there, if you have a reaction, you could return it. They don't give you any issues. If you find the wrong lipstick color, you could return it.
Wow,
They had, yeah, they're known for that.
that's great.
Sephora is known for, if you need a sample of something, they'll even make it for you there. So I've went in before to try the It Cosmetics foundation, and they went in the back, grabbed a little jar, put some in there for me. It was enough for a week. I fell in love with the product. I've been using it for
There you go.
3 years.
Very nice, very nice.
So that's the difference between those two companies. They're actually getting ready to put a Sephora right by us on Lake in Harlem,
Really?
Mhm.
I didn't know that.
right where the what was that, Pier 1? Pier 1 used to be over there, I think. Something like that.
Oh, good.
Pure-
We'll cross
was it
it.
Creighton? Was it
No,
Creighton?
I think it was Pier 1.
All right.
Well, Kohl's is partnering up with Sephora.
Kohl's has a lot. Yeah, Kohl's usually has a small Sephora in there.
Yes.
So Sephora does have some brands that Ulta doesn't have, like some more of the luxury brands too. So moisturizing still is in your advanced regimen, and now you're gonna add in a lip product. Don't forget the lips. Again, this is gonna make a big difference.
We're on step 5, right?
Yes.
Okay.
So they have lip sleeping masks. I'm a huge fan of it. It's like $20 for a jar, and it lasts like a few months or so. You can get them at Sephora.
Okay.
They are amazing.
It just goes on like it.
Yeah, you just put it on at night on your lips. So, after you put on your serums, after you put on your moisturizer, that way you take care of the whole palette there. Your next step would be your physical SPF, your zinc-based SPF.
But you only need that during the day, right?
Exactly. During the day, if you're not wearing, if it's nighttime, you don't need that. And then if you're wearing makeup that day, that's when you apply the makeup after you've done your whole skincare regimen. Then you do your makeup.
Okay.
This is just a little info about like over the counter versus professional. There are some good over the counter products, but you really have to look through that ingredient deck. Over the counter is usually made in larger batches. Professionals made in smaller batches. Over the counters have a lower percentage of active ingredients, and professional products have a higher level of active ingredients. You'll even look at some of the products like from Chanel, and you're paying for the name. You're really just paying for the name. It's not the quality of the products. It's not the raw material. Over the counter products tend to have more fillers so they can make more money off of the product. There's less. And professional, no colors, no dyes. I always get some that have no artificial fragrances, because that tends to add irritation to the skin, even on a cellular level. If you don't see it, that could be happening. Over the counter, they usually, because of all the fillers and everything else, they usually add in fragrance.
And what?
Fragrance.
So the professional products might not smell very nice.
No, and I've used a lot that smell pretty bad. But some of them will, if they're more botanical or fruit based, they'll have those natural fragrances in there, which is completely fine.
Yeah.
So over the counter may have higher pH levels, whereas the professionals are more pH adjusted to your skin, because that throws off your barrier if your pH balance is off, which leaves you susceptible to more damage, especially environmental damage.
So, we're chemists, right? Higher pH means base, right?
Yeah, it's more basic.
Okay.
Yeah, 7 and
And
above.
lower pH is acidic.
Yes.
Okay. got it.
And 5.5 to 6.5 is the average of skin.
Okay, so skin is slightly acidic then.
Mhm.
Seven
Yep.
is neutral.
Okay. Yeah, very slightly.
So over the counter products are made of larger molecules, which don't absorb as well. Product molecules are smaller in professional products, because you need to actually, your body needs to be able to utilize those ingredients, or else it's just sitting on top of the skin.
So how why would that be? So I mean, the molecules are obviously what the ingredients are.
Yes.
So you're saying that the ingredients that are used on over-the-counter products are.
Some are made up
so
of
they're
larger,
totally different than the ingredients. So it's not just that there's fillers,
right.
it's that the ingredients are completely different and they're gonna sit on the skin. as
They don't
opposed-
work it.
Well, you know,
They tend to be not as effective. Sometimes you find some over the counter ones that are great. But typically for the most part, a lot of it's filler, fragrance, and like dimethicone stuff that makes it feel really good, but it's not actually doing anything to help your skin. Over the counter, which this is not entirely true anymore, purchased at department stores. Professional products are sold in professional outlets. A lot of pro products have started selling in stores too. So a lot of estheticians aren't happy about that because they helped build those brands, and the brands, you know, they're not going to turn down multi-million-dollar deals.
yeah,
Better sell it in your stores than the ones in the stores.
Because then we'll get back to that other one where they're starting to make it in larger batches. So it's starting to lose some of that quality care. So I've actually left some brands because of that.
really.
Mhm.
Okay.
Over the counter is like I was talking about with like Chanel and things like that. It's usually overpriced for what you get. Professional, reasonably dependent. I don't say that differs for everyone's budget. Professional products, but typically a cleanser can be anywhere from $20 to $30 for most brands, and that lasts you about 3 or 4 months. So I want to go over some beneficial ingredients just because I want to get people to start reading their labels on their products. You can go home and look at some of your stuff that you have. So arbutin's a tyronase inhibitor, which a lot of these products here are going to be really great for sun damaged skin or skin that has dark spots, excessive pigment in some areas. Kojic acid's a natural lightener that's derived, I believe that one's derived from mushrooms, but don't quote me on that. Vitamin C is an antioxidant that brightens and strengthens the skin. A, C, and E are essential for skin health. Your A is your retinol. I use the C and E that's combined, so I don't have to buy an extra product.
Well, so, you know, if you're taking a vitamin C supplement, is that
No.
totally?
No, totally different,
Okay.
because whatever you take in either
you're
with
ingesting.
food or your anything that you're ingesting, your body's going to utilize to your organs first and your skin last, even though the skin is the largest organ. It's going to utilize it last. So you're getting little to none. So you need to treat it topically.
Okay.
There's turmeric, which reduces inflammation and brightens. There's a lot of really good turmeric masks that you can use. It's phenomenal. I've seen phenomenal results with clients. Licorice root is a natural lightener. Mandelic acid reduces inflammation. It's a brightener. It's a gentle exfoliant. Retinol, like I said, everyone should be using a retinol. It regulates cell turnover. It's a tyrosinase inhibitor and reduces the risk of skin cancer. There's been multiple medical studies.
So what kind of products have retinol that we?
It'll say it on there because it'll be nighttime products. They'll promote it. They'll definitely promote the retinol in there, but a 0.5 is a good percentage to get.
I use Neutrogena with retinol.
Yeah, it depends on the percentage of retinol in there. So 0.5 is a really good amount to where you're actually going to get some benefits. Anything lower than that, I wouldn't spend money on. Higher than that, you could possibly have a little more irritation.
Or it could benefit.
It really depends. Yeah, it really depends on the person. Not everyone can tell. There's a lot of people that I've met that can't handle even a 1% retinol.
What about Charlotte Tilbury?
Yeah, they have some nice products.
Yeah, it's a nice nighttime.
Yeah.
What is tyrosinase?
So what it does, so the tyrosinase inhibitors help to prevent excessive pigment from being made. So those that are prone to sun damage, or if you spent a lot of time in the sun when you were younger, it could show up years later. So it's really good to be on those, because then it starts showing on hands, it starts showing on face, on chest areas that are typically exposed.
Would be known as H spots?
Yes,
Okay.
exactly. That's caused from sun
Okay.
exposure. One thing that a lot of people don't realize is the UV rays actually penetrate through glass too. So if you're like, oh, I'm indoors, I don't need to put any sunscreen on, and you're sitting right by the window with no blinds all day, you're still getting that UV exposure.
Hmm.
But to a lesser degree, correct?
I guess it depends on your windows. If some could be
Oh.
amplified.
No,
Eh, no?
it's impossible to amplify it. I think for most classes, it's a lot less, but.
Okay.
Nothing's gonna be 100%.
And it also reflects off snow, water, all that good stuff.
Okay.
Niacinamide, which is vitamin B3, it works on yellow, brown, red pigments in the skin, and it's very soothing. It's actually great for people with acne and rosacea. I have rosacea myself, which is like I get rosy cheeks a lot. Lactic acid is in a lot of products. Lactic acid is a gentle exfoliant. It also helps with hydrating your skin. So you'll see it in almost all skincare
Well,
has
that's
it in
milk,
there.
right? That's in-
Yeah.
that's
Yeah.
not like- that's milk, right?
So it also has natural brightening effects. People who deal with keratosis pilaris, it's also known as like chicken skin. A lot of people get it like upper arms, some people get it on their thighs. If you find a high lactic acid product, amlactin is, I believe, either 12 or 21%. I have to double check. Maybe 12% lactic. It actually helps smooth the skin out. But you have to use it regularly. With all product, if you want to see results, you have to use it regularly. Hyaluronic acid binds moisture from the air into the skin to help plump. Usually it has other ingredients in there too. More beneficial ingredients. So salicylic acid is good for the acne prone skin. It dries excessive oil and it's exfoliating. It's really, really, really important to wear sunscreen when you're using the salicylic and benzyl.
Okay. Isn't that also in aspirin?
Yes.
Okay.
Yes. So if you're allergic to aspirin, don't use salicylic acid. Benzoyl peroxide that sterilizes the follicle and removes excessive oil and dead skin. So for anyone who deals with the type of breakouts that are under the skin and it's not coming to a head and it's painful, that's where the benzoyl peroxide comes in. Now, it's important to realize that benzoyl will bleach your clothes. So if you use a face wash and wipe your hands on there or something, it's going to bleach it, or whatever you're wearing. So just be careful when you use it.
Mhm.
Tea tree oil is antibacterial, antimicrobial, and I believe it's antifungal. I'm pretty sure because it's used a lot for like toenail fungus.
Mm.
But it's important if you use it for something like that, that you're using cotton socks, not nylon.
Mm.
Because the cotton's going to absorb the moisture better versus the nylon making your feet a little more sweaty. So, or the microfibers. Microfibers are actually horrible for our skin. Zinc reduces inflammation, aids in skin healing. A lot of holistic practitioners actually will prescribe zinc for people with acne too. We tend to use like a SPF after electrolysis, and it has zinc in there because that's going to help speed up the healing and reduce the redness. Mandelic acid reduces inflammation. It's a brightener and gentle exfoliant. We talked. I don't realize how much I put retinol in things. I think I put it in another time.
This is the third mention.
Yes, and we did talk about niacinamide in the other, which is anti-inflammatory, supports the skin barrier, and reduces hyperpigmentation.
I have toenail fungus and I've been trying to get rid of it for years. I buy a topical ointment. We had a person that did laser therapy and
I feel like the laser's hit or miss with it.
so I I think the two treatments for that, that didn't do anything.
Yeah, the laser is really hit or miss for toenail fungus. I was trained in that, and I've tried it on different patients, and some people it helped, some people it didn't. I feel like it's a waste of money. One thing you can do is use a, let me look at the term. I don't know the proper word. There's an antifungal shampoo that you can buy. It's actually made for dandruff.
Ketoconazole.
Yes.
Yeah.
What she said.
What is it?
What-
Ketoconazole.
Keto.
Keto- Like, yeah. well,
Yes. So
I've used Vicks on toe and then.
really,
Vicks, yeah, Vicks is supposed to be help too.
I love the way Vic smells.
No. My doctor
Yeah.
told me to use Vicks and I
Here,
couldn't
hand
stand
it
the smell.
to me and I'll put it back.
Not bad.
So the one that she said, what you would do is before your shower, put some of that shampoo on your toenails that's affected, let it sit for a couple of minutes, and then when you go in the shower, you could wash it off. And then when you get out of the shower, you put a little bit of your tea tree on. So, but you could wear the tea tree without socks, or if you do wear socks, wear cotton.
Ketoconazole, wait, how do you spell it?
Oops. Oh, there.
Ketoconazole.
Okay, you lost me at the
Shampoo.
KETO.
CON
CONAZOLE.
AZOLE shampoo.
Shampoo, thank you.
Okay. Yeah, so I dealt with it for a short-term period because, well, that's what I did. It helped me drastically. I have a esthetician friend who's also a nutritionist and electrologist for over 20 years. She taught me that tip and it worked. I went to a local place for a pedicure and I noticed I started seeing the irregularities in my toenails. And so I didn't go get a pedicure for about 4 months while I was taking care of it. Yeah,
For your toenail.
exactly. All right, the best trio is your good sunscreen, your retinol, and your vitamin C, which is going to repair, strengthen, and protect.
Okay. Okay.
Skin and makeup. So this makes a drastic difference. You'd be surprised. A good regimen will lessen the amount of foundation coverage you need, meaning you're using less product. Exfoliating helps the skin texture, which will help foundation go on flawlessly. Incorporating the lips in your regimen will help your lipstick apply better, smoother, and longer. Moisturizing gives the appearance and plumpness of healthy, glowing skin. And you always double cleanse after wearing makeup. It's best to start with the oil cleanser first because that'll help to break down that makeup better. There was something I was just going to leave in and I forgot.
How many women have done that?
I have.
Okay, all right. I'm
Not,
saying,
not
it
often.
does happen.
Maybe a couple times a year.
Depending on how much you drink, huh?
Yeah.
Yeah, that does factor
What was
in.
the third one in the trio?
Vitamin C.
What?
Vitamin C.
Vitamin C.
I can send you these slides.
I could also, by Monday, there's some things I want to tweak, but by Monday I could send this to you if you want to share it with everyone. I'm fine with that.
What do you think of Il Makiage?
They have some really nice makeup.
I've been using their makeup now for a year and a half.
So I haven't used it yet. I've tested some stuff and I was pretty surprised at how good it was. It creates really amazing coverage.
Oh, yeah.
Where is it available?
I think
You go
online. It's online.
And they do an evaluation of your.
They ask a
skin.
bunch of
A
questions.
lot
Yeah.
of questions, then they send you a sample. And the first time you could try it before you buy it.
Yeah.
And then, I mean, I've gotten into it. I love the product.
Yeah, they have I've heard nothing but good things about that brand. What else was I gonna add in? Another thing that not a lot of people use, but they should, is a primer, a makeup
I
primer.
use a primer.
Yeah, it actually helps to fill in lines and things. And a lot of them will have, I believe it's dimethicone in there, which creates a really silky feeling. And you wind up using less less foundation, like a third of the foundation that you would typically use.
Using the primer. I use the
Exactly,
primer.
exactly. You wind up saving so much product using one. So the biggest brand that's known for it is Smashbox.
I use that.
Yeah, Smashbox is like the bee's knees. Yeah.
It's so good.
And they have a green one, which is a corrector for those with red. I have red skin, so I try to go towards those. If you don't want to spend $30 on a primer, go to NYX, NYX. They have them for like, I think it's like $11. A lot of times, like once a month, if you sign up for Ulta's emails, they'll have a deal where the NYX products are buy two, get one free. So, or buy one, get one half off. So, and they have a lot of good products. They really do. Yeah, I'm telling you, NYX. Mhm.
Oh,
Mm-hmm.
okay.
Yeah, I've used Urban Decay, I've used Chanel, I've used Dior, I've used all these products you could think of. Urban Decay is one of my favorite. NYX is one of my
It's
favorites.
very reasonable.
Yes, they are. They are. Okay, we're getting towards the end.
Okay.
So I didn't want to get too into it. A lot of people have heard us talk about electrolysis a million times, and you're probably sick of hearing about it. You know where we are. So there's Sabrina and I. We kind of alternate schedules, but I'm going to go through the different methods. So there's temporary hair removal methods. That's going to be your waxing, your epilating, which those things terrify me. Every time someone comes and say they use one, I just can't believe it. There's no way I could go through that. Sugaring and tweezing. Sugaring is they literally use sugar, lemon juice. I don't know if there's anything else. And they make a paste out of it, and they rip the hair out. Yeah. It's like waxing, but I've heard it's less painful, but I've also heard it's still painful.
Sweeter.
So yeah, that's another technique that's been becoming more popular lately. However, it's been around for like hundreds of years in some cultures, probably longer in some cultures. Now there are times where the waxing, epilating, sugaring, tweezing over time, and I mean years for most people, on body, not on face, can actually traumatize the follicle enough to where hair doesn't grow. It gets very patchy, or it thins your hair. That's not the case for everyone, but some people that does happen to. Reduction would be your laser hair reduction, and your enzyme retardants. Now, with the reduction, it thins the hair out. Some hair doesn't come back, but it's not 100%. It really varies on the
It
person.
doesn't work too much if you're gray.
It doesn't. Yeah, it's not.
Doesn't work at all.
No, the hair has to have color.
Right.
It has to have pigment. It's attracted to the pigment in the hair and the skin. That's why it's not optimal for someone with darker skin tones to use laser, because it's going to be attracted to that skin pigment first. So it doesn't work on grays, blondes, reds, any of that. That's where your electrolysis comes in. And the enzyme retardants are usually like a topical that you put on after waxing or tweezing, and it slows down and inhibits hair growth. Permanent, you're stuck with us. That's your electrolysis, and it does take time to complete. Typically 9 to 18 months. 3 years is more realistic if we're clearing a whole face. Some people that could be 5. It depends on how consistent you are. Really, consistency is key with it. I've finished people in less time. Yeah.
What about the rest of the body hair?
Rest.
Legs and arms?
So that's a little easier because it's less hormonally driven than facial hair.
Oh,
And it depends on how much hair you have and how close they are together. There's a lot of times where we see someone that comes in, they have lighter skin and darker hair, and they come in wanting electrolysis, and really they're being a little unrealistic because they don't realize what a commitment it's going to be. So both of us will recommend that they go start with laser first. And then they come, and that way they don't waste money or say electrolysis doesn't work, because we have to sit there and go one by one, and there's
Yeah.
tens of thousands of follicles that we have to treat.
A million times.
Yeah, yeah. So if your hairs are pretty sparse, like you get sprigglies here and there, that's really easy to treat. So,
I think with body hair, probably laser is a better option so long as the hair's darker,
mhm.
because you have a lot of territory to cover.
Yes.
And the laser can go really fast while the electrolysis take time to hunt around for the hair.
Oh my gosh, yes. So the girl I go to for laser on lower body, I'm in and out in like less than 15 minutes. And I would go in like once every 6 weeks, because hair on the body grows slower than the face. Different growth. What to expect from a good electrologist? There's not a lot of electrologists in Illinois, and sadly, even in surrounding states. We get clients from Indiana, Wisconsin, because there's a lack of electrolysis, especially electrologists that work with the community. So it's important that they have a clean environment. It's important that they recommend pre and post care, home care, because that's going to make a big difference with your healing. It's going to reduce inflammation, brighten, and protect. Someone that can refer out if need be. If they can't handle the hair load that you have, they need to recommend you out to someone who's more capable of it. There's some electrologists who only do 15, 30-minute appointments, won't do any more. You're never going to get done if you have a full face of hair, and that's all the time they're doing. So it's, it kind of shows a lot about them if they do refer out a case where you feel like you're not seeing progress or that. They'll also educate you on the effects of picking and tweezing. Again, picking is going to hinder your skin from healing. So just leave the skin alone. Skin heals amazing on its own. They're also going to like scratching at areas that were just treated, things like that. Also, they're going to keep a chart of your progress throughout every session. That's really important. So every session, they should be charting down how much time they're doing, what their settings are, how your skin's reacting. If your skin reacted, bad one time or good one time, they should have that all logged for you.
I never looked at my charts.
Yeah.
If you're saying that, I presume you kept them.
Yep. Well, it's at Kelly Inc.
It's at
That's
Kelly,
hers,
okay.
yes. But yeah, you have a chart with all of your treatments on there and all of that. It'll also, I also like to chart down if my client's having like a little more sensitivity one day or the next, versus the last time. Which that could have many factors. It could be stress. It could be because you haven't eaten. It could be you're on an antibiotic or medication change. Some people right before that next shot of, I don't know, is it the estradiol? Is that what it's called? Yes, before they get to their next shot, some people start getting a little more irritable, a little more sensitive.
Why would you say such a thing?
I when they start acting like that, I'm like, okay, you're acting like a diva today. So things to avoid after any of those treatments, any of those hair removal treatments, you're going to avoid over exfoliating because you want your skin to just repair. You're going to avoid excessive heat and sun. You're also going to avoid overstimulating post-care products. Now,
For example, what was that?
so some people will use post-care products with like a menthol or spearmint, something in there that for some clients that could be a little too oversensitizing. Especially that's more for medium to darker skin tones that are prone to hyperpigmentation or someone that has rosacea. So that's why it's important for someone to know skin, It helped me with electrolysis because I was an esthetician for so long. That's why it just boomed like that.
Stephanie, how long have you been doing that? Esthetician
2011 aesthetics, electrolysis, I think it's been 4 years, something like that.
Okay.
Well,
I don't know. I don't remember.
You started treating me in 2019. So.
No, I think I started a year before that,
I
right?
think-
Yeah, a
I
year
don't
before
think
that.
was your first
I
one,
did
but-
extra training though. So even before I went to school for electrolysis, I was already taking training.
You worked for Kelly for quite a while too. didn't
8.5 years.
you? Yeah.
Also, after treatment, even if you do like facial waxing, your electrolysis, it's great if you could avoid makeup that same day you get treated. You want your skin to heal. You don't want to cover it up. A lot of makeups tend to be a bit heavier.
How long has Sabrina been doing electrolysis
So I graduated in 2019 and pretty much since then, but I've been working for Kelly for 2 years also.
okay, I was wondering.
Any questions for me so far? I only have a couple of things left, and it's not really much. No? Okay.
We were trying to cover most of
Which
what.
I prefer that. I honestly prefer that because it's easier. Okay. So for the past month, I've been kind of going around to different places in the area, contacting different business owners. For me, it was really important to have this. It's service providers that are trans friendly in the area. So a lot of these are actually in the other suites in our building because we were trying to find something central. Like I have some clients who, may want to go get a Brazilian blowout or something to their hair after their electrolysis. So it's just important to find these things that complement each other and are also safe spaces. Hair care, we have a lady next to us. She's a sweetheart. Her name is Alva, Divine Design. She also does wigs. So she could also fix your wigs, clean your wigs, style your wigs, install your wigs. She could do lace front installs. My one friend goes to her for her lace front installs.
Are you familiar with
Yeah.
Yeah, brows. I just had my brows.
Oh, get out of here. Yeah.
I've been going to D for several years.
I seen her last time I seen her was earlier this year, I
She just
think.
moved to Regenerate Health Spa in Oak Park, in Oak Brook.
Really?
Yeah, instead of her place in Oak Park.
No, this is someone else we're talking about then. I'm thinking of someone who used to come to meetings, but I don't remember who she would come with. Yeah, I think it's someone else. Dee Bellinger? No.
No.
So Divine Design is one that's right.
Yes, she's right next to us. She has a suite right next to us. Then there is Lucky Salon.
D Stanford.
No, I don't think I know that person.
Used to be D Design View. She used to be in Oak Park.
Oh, yeah, I'm
Yeah,
not
she's-
familiar with her. So Lucky Salon is on the second floor. There's no elevator in our building. It's 2 floors. It's a little short stairwell. We're on the first floor. We picked our spot because we didn't want to deal with stairs. Lucky's is upstairs. She actually just moved over from a really, really popular salon in Forest Park called Mac Daddy's. She was there for, I think, close to 10 years and decided it was time to go out on her own.
Okay.
It seems like she's been pretty busy. It took me a month to get an appointment. I still haven't got it yet. So she's an option for cuts, color, all that good stuff. Skincare, there's Glam Heart Beauty Studio. I only take new clients from the community for aesthetics. I don't take any other new clients just because there's not a lot of places to go that know what they're doing. And also how hormones affect the skin, the hormone therapy.
You know Jill Jensen?
Yeah, maybe by face. I'm a face person. No. There's actually an injector. She just yeah, the person that I used to send people to for injections she moved to Colorado, but she trained another girl under her, and she also does sclerotherapy, like on your veins.
I've been going to her for fillers and such, Lumon, Juvederm, stuff like that.
I haven't tried. I'm a little afraid of this, so I haven't tried it yet.
Now she's working to rejuvenate med spa.
Yeah, I've heard of that place. Yeah, I have heard of that med spa before. So
Under hair care, I want to put in a plug for Snip City.
okay.
Yes.
Yeah, I'll add them
They're
in.
in South Oak Park Avenue. That's where I go.
Yeah,
for my
they've been
hair.
there. They've been there forever.
Forever. Oh,
Yeah, I
forever.
remember when I was a kid, they were there.
Yes. Both of my daughters have been going there since they were, babies.
Yes, so I'll definitely add them in. Makeup. We actually have someone there that does makeup, Glam Heart Beauty, the same girl who is an esthetician. She's a part of the community herself. And when I spoke with her, she got really, really excited.
Okay.
So she's really sweet. She's on the second floor there, and she does event makeup, all of that good stuff.
Great.
There's a girl who does lashes, who is a little bit further down the hallway from us. Her name's Louie Lashes. She does the extensions. If you're patient,
I go for lashes.
yeah, I only do the strips, you know, an hour and a half to 2 hours for, you know, to lie down and get your lashes. I get a little impatient.
How long does that last?
You have to go 3 weeks for a fill-in typically.
Yeah, 3 weeks. If you go 4 weeks, it's a full set.
Yeah.
Which I just said I'm done because of my brows not being done. But it's about a week out now. I think they're looking fine.
They do, yeah, they look good.
Stephanie, did you see the chat from?
Oh, okay, lidocaine.
Alice? Who do you?
So I use Dr. Roche.
Oh, okay.
So I think you've seen, have you seen her before? She also, yes,
Dr.
so
Roche
she,
is the one for the throat.
yes.
she's
So
fine.
Dr. Roche is with us.
She's
She
one
came
of-
along with us.
I have her all-time record of 110 cc's.
Still, yep. I had a client yesterday with 90 cc's, 5 hours of work for me. It was surgery prep. So yes, Dr. Roche is available for
That was
us.
a 12-hour session.
Oh gosh. Yeah, that's insane. We have both of us recently talked with this girl who owns Cherry Bunny Beauty. She does full body waxing.
Mhm.
She's really sweet.
She's
Yeah.
really nice.
There's a place that does microblading. I think you went to my girl Constance, which was further. You went to Constance, yeah?
No, microblading was done by D.
Oh, okay. I don't know why I thought you went to
But then
Constance.
Farrah Fuentes has done after that.
Touch-ups.
After you get the initial, which
Mhm.
lasts a year or two.
Mhm.
I mean, I take care of it. I go in there and she colors. After about a month, I do about every 2 to 3 weeks.
Okay. So you're doing tinting on top of that? Okay. So the microblading, there's a place at the end of our block along North Boulevard. It's called Midwest Microblading.
Really?
And she's done one of my redhead clients. If you can do redhead brows, you can do anyone's brows. She does a really good job. She also owns Bird Bone Tattoos.
Oh, I know
So
Birdbone.
yeah, so it's the same person. She does the microblading tattoos.
Birdbone used to work for D.
Really?
time.
Get out of
before
here.
she started her own.
How do I not know this D?
Oh, you know, D used to work for Dr. Who used to go out. You know, Dr. Parisi?
No.
He's a plastic surgeon.
Where is that north?
He's in,
You have tattoos?
no, because I can't do that anymore because I have. issues.
Hidden. No.
No, Dr. Parisi's in Downers Grove. He did my nose.
Oh, darn.
and
No, I
he-
haven't heard
He
of
did
him.
my breasts. And D came in and did other things for her.
So she was like his PA or
She came in
okay.
and did things, but because of some health conditions I have, I can't really do waxing anymore.
Okay.
I bruised too.
Oh, okay,
I've
okay.
been on HRT for about 3 years, so I bruise real easy.
And also some people with vitamin D deficiencies tend to
Well, I
bruise
also
very
have
easily.
Kidney issues.
Yeah, so there's like medications and things that could increase. That's why we ask too during your intake all these medical questions, because that could affect, you could bruise easier. You could have delayed healing, things like
Oh, I
that.
bruise really.
So this is our location. We're located in the My Salon Suite building. They own that building. They have 2 floors. They remodeled everything. It's a pretty small suite for what we pay, but we're happy in the location. It's a really, really great location. There's if it gets busy. Yeah, it gets busy. Like Friday nights are busy, Saturdays are busy. Lunchtime, Thursdays in the summer because they have Thursday night out, which that's so
Oh,
much
that's
fun. We
right.
went a bunch of
Right.
times this year.
Ooh, and a ramen, yeah.
Yeah,
Let's
they
do
close
it.
off the whole block.
Yeah.
So we're right in front of the fountains.
And is that a ramen place?
It
next
is
door?
a new ramen place, Carey Ramen. They're all over the world apparently.
Really?
Yes.
Didn't know that. Obviously, you're very close to the Marion Street exit. off.
Cynthia, I'll have to drag you there again.
No, no, please.
there's a cute little French place a couple doors down. It's really nice for lunch.
Oh, wait, I think I-
Leah's, oh my god,
Yeah.
this is one of my favorite places. So they do Parisian sandwiches and baguettes and like croissants and whatever else I can't pronounce.
Yeah, I don't recall, across the street there is the Chinese place, right?
That's not there, that they
Oh, they're
haven't,
not?
Close.
they just
Closed?
disappeared, to be honest.
They
No one
just-
knows what happened.
No one knows what happened.
Sugar
Okay.
Fix is across the street.
And I'm not a fan of that.
But
place, but-
I'd been to Lanote before the ramen place went, of course, Lanote just moved, they didn't.
Yeah, yeah.
So
So there's a lot of options over there. Like if, someone came middle of the day and wanted to meet out after with girls for lunch, there's a lot to do around that area. Okay, that's about it. I put up my information on my Instagram, Stephanie Carey CPE. And we also have a Luna electrolysis page on Instagram.
Okay.
What else? Was that it? That's it.
Thank you